Today I want to talk about fibroids. These are growth that occur in the uterus. They normally occur in different positions of the uterus and they vary in sizes. The impact on the ability of the patient to get pregnant depends on the location of the fibroid and the size of the fibroid. Okay, most fibroids disappear as someone gets pregnant. So it's a common advice to anybody who has this experience, to get pregnant to avoid fibroids. Some can be given medication and they shrink off, and others require surgeries. So depending on the size, it will be important to do a pelvic scan so that to ascertain the size and the position of the fibroids. One of the major causes of secondary infertility is a growth of fibroid that is between the first pregnancy and the second pregnancy. Primary infertility and secondary infertility refers to a case whereby a mother who gave birth once and they are not able to conceive the second time. This one is called secondary infertility. Now, such a case could be as a result of other things, including hormones and fertility, the sperm count from the male, but most probably a fibroid can be another hindrance. Fibroids in detection, like the ones that grow towards the inside of the uterus, and if they become bigger in size, can prevent penetration of sperms into the ovaries, so there is no fertilization that can take place. And in such a scenario, then the patient is referred to an ultrasound whereby you confirm the position and the size of the fibroid. If it's big to some level, then it might require surgical intervention to help the patient become pregnant. But if it's small in size, depending, it can be given medication and most of them shrink off. And the characteristics of fibroids are heavy bleeding, heavy menses. You might bleed and sometimes have clots in your normal monthly flow. And sometimes they increase in times, like from 3 days to about 1 week or 2 weeks. Keep on following, ask any questions that you want. We will be there to answer in our subsequent videos.